Hello. Welcome to our live presentation. My name is Edith, and I will be glad to have every one of you join me today. It's nice to have you all, and at every point, if you have any questions, please do not hesitate to send me through my inbox, and I will definitely address them. I don't want you sending your questions through this means because I wouldn't want a situation where I want to be able to address your questions appropriately. I wouldn't want to leave your questions unanswered. All right, so I'm going to be talking to us, or we are going to be having lots and lots of conversations about STIs, STDs, sexually transmitted infections, sexually transmitted diseases, and there's a whole lot that you would really want to know. So in the last couple of weeks, maybe 2 weeks, I would think that we've been on the COVID lockdown, and you wouldn't imagine, but then after the lockdown, there's this high increase in the number of people with STIs. So now this brings me to what we're going to be talking about today, and that is the prevalence, how people contact STIs, how you can identify the symptoms, and of course how you can treat them. So I have some statistics, and very interesting statistics from the World Health Organization. So over 1 million sexually transmitted infections are acquired every day. So every day there is over 1 million people getting and giving sexually transmitted infections. Now every year there is an estimated 376 million new infections, and these new infections range from gonorrhea, chlamydia, syphilis, and herpes. Now there is more than 500 million people who have genital infections, especially the HSV, and those are the herpes simplex viruses. More than 290 million women have the HPV virus, which is basically what causes cervical cancer. And you see why I'm really interested in this topic. The majority of STIs have no symptoms. So this is what I want us to understand today. And that is why we're going to be having this conversation. Majority of these STIs that we know about do not even show symptoms. So how would you even know if you're carrying any of these STIs? And then over 1 million pregnant women are infected with syphilis every year. And of course, you know what happens with syphilis. During birth, during delivery, it is transferred to the newborn and all of that stuff. In some cases, STIs have horrible reproductive effects on both the woman and the man. So we see young folks in their late 20s or early 30s, and they're having struggles with infertility. Now, it probably isn't what you're thinking. It probably could have been an untreated STI. It probably could have been something that was not addressed when it was supposed to. Also, due to the resistance of most of this antibiotics, most times the treatments that are given are not very effective. So how do you go about treating it should you have any of these symptoms that I'll be talking about in a minute? Okay, so there are about 8 basic. Now there's over 30 of them, over 30 sexually transmitted infections, but basically there are 8 of them. Now this 8, 4 of the 8 have they have cures, so they have treatment, and the other 4 are viruses that do not have treatment. So the first 4 that have treatment are the gonorrhea, syphilis, trich, and chlamydia. Now, gonorrhea and chlamydia kind of go together. So most times when you go to the doctor's office, they're treating you for gonorrhea and chlamydia at the same time. Now, the other 4 that do not have treatment are mostly viruses. Of course, we know viruses do not go away. They just replicate. Sometimes they go dormant, and after a while, they replicate. So some viruses, or most of the viruses, do not actually die. Most of them just go, they just go quiet after a while, and then they replicate and all of that. So we have the HSV, which is a herpes simplex virus, the hepatitis B, HIV virus, and human papillovirus. Okay, so STIs, just like we all know, I'm gonna be a little, I'm gonna be really, really direct. Not a little. I'll be really direct. I'm gonna be very professional because these are the issues we attend to every day in the outpatient clinics. So people come in the clinics and they have no idea what's going on. They have a discharge from the penis. They have a discharge from the vagina. It's itchy. It's smelly. They're having wounds that are not really hurting. They're not painful, but they're not healing also. And sometimes they come around with things that look like cold sores, sores around the mouth, sores around the genitals, and they just have no clue. So when people come in with this, the first thing that I want to do is find out. So how do you know if you have an STI or not? Now, if you've ever been sexually active, and I'm talking about at any point, if you've ever been sexually active, there is a 1 out of 5 chances that you could have had an STI. Sometimes it could have gone without even being treated, and some other times you probably would have noticed the symptom, or maybe did not just want to attend to it. Okay, so STIs, just like they sound, are sexually transmitted diseases, and they are predominantly transmitted through sexual contact. And when I say sexual contact, I'm talking about both oral, vaginal, penile, and anal. So however you want to define it, whatever involves an an exchange of body fluids, an exchange of blood, an exchange of anything that has to do with the body, any kind of bodily fluid exchange can actually result in some of these infections. Okay, now there are also non-sexual means of transmitting STIs, and we have, of course, during blood transfusion, during delivery, when a woman is trying to have a child, during kissing, during, it could be just a touch. It could be, some viruses actually transmit without necessarily, without any necessary sexual intercourse. So let's see. Things like hepatitis B, of course, we know syphilis, gonorrhea, chlamydia can be transmitted from the mother to the baby during childbirth. Now, I said in the beginning that some people can actually be housing these numerous STIs without even showing any symptoms. Now, that is the worst part of it, because what happens, they go around spreading them without even knowing. So when you come back, for instance, and you say, because I had this lady who came in and said, she had a little burning with urination for a couple of days 2 weeks ago, and then her boyfriend came back and told her a few days ago that he had discharge, penile discharge. So it was at that moment that she decided that it was necessary to go to the doctor's office. So when she came in, and it was we ran tests and all that, and of course she had the gonorrhea, but she never knew. She did not know she had the gonorrhea. So, and the boyfriend, of course, if he hadn't been monogamous, if he had kept over maybe 1 or 2 or 3 or 4 partners, chances are he probably wouldn't even have been able to come ask her or tell her about his symptoms. But he was able to talk to her about it because she was apparently his only contact. Okay, so I already started with a little bit of statistics, and this is alarming. Every day the numbers are on the increase. Every day the numbers are increasing, the numbers are tripling, and that is really concerning. We have to be responsible for our health. We have to educate ourselves about these issues and come to address them. Now, STIs can have really, really bad consequences beyond the immediate impact on the effect of the infection itself. So, STIs like herpes and syphilis can increase the chances of HIV in any individual. Now, we're going to talk about that in a little bit. Then the mother-to-child transmission of STIs can result in stillbirth, meaning the woman has the baby and the baby dies, neonatal death, low birth weight, and premature delivery. It could also result in sepsis. It could also result in pneumonia, in times like if in patients with chlamydia. It could also result in neonatal conjunctivitis and congenital deformities. And then approximately 1 million pregnant women were estimated to have had syphilis in 2016. And of course, most of these women had no idea they had syphilis, and most of the husbands or the sexual partners had no idea they had syphilis. This resulted in over 350 deaths during delivery. Now, HPV, which is the human papillovirus, occurs in over 570,000 women. Now, with over 300,000 women having cervical cancer death every year. So, you see why we really have to address these issues. STIs such as gonorrhea and chlamydia are the major causes of pelvic inflammatory disease and infertility in women. So let's take, for instance, a woman has untreated gonorrhea, and of course without symptoms, or maybe with symptoms that are so mild she didn't even bother to look for treatment. Now, when it's time to get pregnant or have a baby, she begins to have some difficulties because what happens? The gonorrhea, the STIs have actually reduced the ability of the cervix to actually close and carry the baby and all of that stuff. Now, we want to come down to prevention. Okay, how do we prevent this infections? And that's why we're here. That's why I'm here. That's why I'm talking to you today. So the basic method of preventing STIs is by education. Now, how much of this do you know? How much of these STIs do you know? I'm going to be starting a little bit with gonorrhea. So gonorrhea, for instance, is mostly transmitted through sexual contact. And when I'm talking about sexual contact, I'm talking about penile, vaginal, contact. Now, have you ever seen oral gonorrhea? I have seen it so many times. And of course, how did these people get it? They got it through oral sex and all of that stuff. So when you meet someone for the first time, I know it's going to be kind of awkward for you to ask them to go have an STI screening. But of course, when you're not sure about the person's, status, you want to make sure to protect yourself. Now, diseases like gonorrhea are usually not symptomatic, except in the man. Now, a woman can carry gonorrhea for as long as possible without having any symptoms. But then a man, once he gets gonorrhea, of course, he starts having this pus-like discharge. It's yellow, sometimes it's green, sometimes it's foul-smelling, sometimes it burns when he's trying to urinate, and sometimes he has pain in his lower abdomen. Now, at that point, he decides to either go look for treatment, or sometimes people ignore them because, oh, it doesn't hurt that much, or I just got to do this. I met this new girl. I just got to do this. Okay, so in a lot of people, gonorrhea do not actually have show symptoms. So people carry these diseases and infections around without even knowing. So the first thing you want to do is find out the sexual history of your partner. I know it's like that's probably rocket science, but it will save you a whole lot down the line. Now, I'm going to talk about syphilis in just a little bit, but before then, I'm going to talk about chlamydia because gonorrhea and chlamydia actually go together. So chlamydia is also a sexually transmitted infection that you might really want to know about. Usually, when we treat gonorrhea, both of them kind of have the same symptoms. So when we treat gonorrhea with, maybe azithromycin, ceftriaxone, we give the azithromycin for chlamydia. Now, I'm just going to, I don't know if I have. All right, guys, sorry, I had a little bit of interruption. Okay, so I was talking about chlamydia before we start, but anyway, let me talk a little bit about syphilis because I have it right in front of me. So with syphilis, there is a huge interruption or disruption of the epithelial or mucosal barrier. So what happens? In primary syphilis, when people contact syphilis, for instance, they have an interruption in their skin integrity. So what happens is they get a chancre. It's called an ulcer. It's very painless, and that's how you know syphilis. Very painless ulcer in the first maybe 3 to 6 weeks. Then this increases the number of HIV target cells in the genital tract. So of course, if you have anything that that messes with the integrity of your skin, that causes your skin to break down at all, it exposes you to having HIV. Now, this induces the secretion of cytokines, which are pretty much increasing HIV shedding. All right, so I'm gonna go next. So with the syphilis, of course, with primary syphilis, we have ulcers. Now, these are really painless, so it's possible for one to have the ulcers and is still sexually active. It's possible for one to have the ulcers and don't even feel a thing, and that's why, I mean, why would you even want to bother if you have an ulcer that really doesn't hurt? Now, so with the syphilis, there is a primary, secondary, and there's of course the tertiary, and then there's a latent syphilis. Now, throughout this whole spectrum of syphilis infection, people might actually not even be, they might not even be contagious. So it's possible for someone to have syphilis, primary syphilis, secondary syphilis, tertiary syphilis, latent syphilis, and not even be, they might not even know, except when they start having the sores, or they start having the boils all over the body, or they start having some kind of neuropathy, or some kind of syphilis induced mental disorders. All right, so the main one that I want to talk about are the ones that actually cause people to have sores, and some of these sores are not painful, like I said initially, the syphilis, but of course we have the really painful sores, which are the chancroids, and then the genital herpes, the herpes viruses, they cause some really painful sores. Syphilis, lymphogranuloma, and venereum, the granuloma inguinal, do not cause pain. So, primary syphilis incubates in about 10 to 90 days, about 3 weeks or thereabout. It comes with a chancre in the early stage. In the late stage, it's clean, it's painless, it's indurated, meaning it kind of swells up a little bit, and it has some smooth, firm borders. So you'll have a little bit of, it kind of looks like, I don't know how to explain it. It just looks like a little ulcer, and it's just painless. It's just there. The integrity of the skin is actually compromised, but it just doesn't hurt. Now, with some people, they don't notice it. It resolves in about 1 to 5 weeks. Now, at this point, between the 3 to 6 weeks, it is really, really infectious. Okay, when it doesn't hurt, it's infectious. All right, so I have a little picture here. I don't know, you probably can't see it. Let me see. You see how the little thing looks on the penis? Okay, so that's what it looks like. And you could actually, in women, you could find this on the labia. Usually it's on it's on one of the either labia of the woman. So it's usually very painless, but of course, like I said, at this point it is very, very contagious. Now, also, when we see the women with syphilis, sometimes when we do the vaginal exam, when you insert a speculum into the vagina, you see the cervix. It looks really, really red and ulcerated. Now, with an ulcer in any part of the vagina or any part of the penis, there is an increased risk for HIV. Okay, so secondary syphilis. I talked about primary syphilis already, with the chancre lasting for about 3 to 6 weeks, and it's very contagious at that point. Secondary syphilis represents it's a dissemination of spirochetes. Okay, you probably don't want to know about that. It lasts from anywhere from 2 to 8 weeks after the chancre appears. So what happens? You have a sore in the vagina, you have a sore on any of the labia of your vagina, or you have a little sore on the cap of your penis, or somewhere around the penile shaft or whatever. It doesn't hurt, and you feel like, okay, I'm good with this. You're really contagious at that point, and then 2 to 8 weeks after, the individual probably has it. I'm not going to say you, okay? It's not you. So about 2 to 8 weeks after, the individual comes up with a rash. It could be all over the body, usually on the palms of the hands and then the sole of the feet. Now, there could also be patches in the mouth in areas where we have mucus secretions. There could be patches in the mouth. There could be patches in the vagina or in the penis. Then at this point, we have the warts. At this point, the individual has some warts. So these are called condylomata lata, and these are really, really infectious. Now, the person comes up with constitutional symptoms, and I call them constitutional symptoms because it varies from person to person. Now, this secondary syphilis usually resolves in 2 to 10 weeks, okay? Now, like I said, they have rashes on the palms, they have rashes on the sole of their feet, they have some ulcers in the mouth. Probably not everybody, because I've known some people that have had syphilis for 10, 15 years and never had to deal with rashes anywhere. Okay, so sometimes you could also find the rashes on the body. So if you, I mean, that the rashes didn't appear on the sole of your feet or the palm of your hands does not necessarily mean that they're not there. Okay, so like I said, they have sores around the mouth or inside the mouth, sores in the gum area, and then there is the wart. It looks like they look like moles. They look like little moles somewhere, anywhere around the vagina or anywhere around the penis. All right, so the diagnosis and treatment of early syphilis pretty much is based on clinical presentation. So someone comes into you to see you, and oh, I had sex with some random person 3 weeks ago, and today I just have this painless ulcer around my labia or around my vagina or around my penis. And what are you gonna do? Or if you happen to be experiencing any of this, what do you expect from your doctor? So you go to your doctor's office. Usually they would order a urine test and maybe a blood test, because sometimes we want to run a panel to check for every all of these 8 different STIs. So usually a one-time shot of penicillin would take care of it. About 2.4 million units of penicillin, just one time. Okay. So genital herpes, this is the virus, and I told you in the beginning it doesn't have a cure. So the best way to actually take care of it is to prevent it. Now, this comes with direct contact. It could be asymptomatic shedding. So sometimes the individual probably doesn't even know they have it. Just like I told you, viruses usually don't die. They only replicate after a while. Now, primary infection is commonly without symptoms. So people have the infection, they don't have the symptoms. Now, symptomatic cases, sometimes severe, prolonged systemic manifestation. So sometimes you find out that the people have a whole lot of systemic. They could have a fever, they could have sores, it could be a whole lot of systemic manifestations with prolonged symptoms. Now, the most important thing I want you to take away with is from this little talk is they come up with vesicles. And when I say vesicles, let me see the best way to describe vesicles. Vesicles are little fluid filled bumps. Okay, they kind of look like balls, not really like balls, like chicken pox. You know, where you have a cluster of chicken pox or a cluster of balls. So it could be anywhere. Sometimes it could be on the suprapubic area of the what do you call it, genital. It could be around the lip. It could be around the mouth. Just a second. Okay, hold on 1 minute. I will be right back. Sorry. I haven't done this before. This is lasting a little longer. Okay. So, my apologies. I never knew this was gonna last this long anyway. So, but I'm gonna try as much as I can to ensure that we get the most of this broadcast. Okay, I'm gonna have to use this, unfortunately. Sorry, guys. All right, so that's better. Okay. So, like I was saying, Now, these vesicles are painful. These are like ulcerations. They kind of, I'm trying to set this camera pretty good. Okay. So, these vesicles are really painful. They come around like maybe chicken pox or, let me see, how do I explain them? Yeah, they come around like balls, like little balls, maybe scattered all over or just in one spot. Now, a reoccurrence is potential because these are viruses, so they usually don't go away. So with the HSV, of course, the first thing we want to do is a culture. We do the Western blot test, and then of course we do the PCR to check the level of infection. Treatments are usually very simple, a cyclovir, any kind of antiviral. It doesn't really treat it, it just keeps it away and keeps the person from being contagious. So these are not the best pictures again, but here. I don't know if you can see what these penises look like. You see the little balls on them? Yeah, that is exactly what the herpes look like. And then in the female vagina, you see the little sores on there. You see the little balls. Okay, that's what it looks like in the female. Now, it could be really worse. It could be actually worse than this in real life. Okay, so I'm going to be talking next about the ones that cause a drip. I already told you a little bit about gonorrhea, so we're not going to talk about gonorrhea for a minute. But one thing I want you to know is that with gonorrhea, like I said earlier, there is going to be some discharge. And of course, some people are very asymptomatic. Some people do not actually show symptoms. So if you have someone or if you happen to observe any kind of genital discharge, any kind of, pus looking purulent or colored green, yellow discharge, I think you should actually go see a doctor. All right, so with gonorrhea and chlamydia, usually both of them go together, like I told us earlier. And of course, the treatment is just a single dose of ceftriaxone injection and azithromycin. And of course, this is just one time, so you don't have to, keep taking it for a long time. Okay, pelvic inflammatory disease. I said earlier, gonorrhea, chlamydia would usually cause pelvic inflammatory disease, and of course this would in most cases lead to infertility. 10 to 20% of women with gonorrhea and chlamydia develop pelvic inflammatory disease. In Europe and North America, a higher proportion of chlamydia and gonorrhea would have been seen in women with PID. I'm going to be calling it PID, I'm sorry. Now with PID, the first thing we notice is cervical motion tenderness. So how do we explain that? When you try to move, your speculum in the cervix, it really hurts. It's painful. Okay. Now the complications are infertility. In some cases, there could be endocervical discharge. So when you look when you look with a speculum into the cervix, you see some discharge. Sometimes it's yellowish, sometimes it's greenish, sometimes it's foul smelling. Many times it's really not. Now, the individual could also have systemic symptoms such as fever, and then they could also have abdominal pain. The complications are just numerous. Infertility in about 15 to 24% of people with PID, and then 7 times at risk for ectopic pregnancy. Why? Because whatever affects the cervix definitely travels up into the uterus, and it's kind of just messes with the uterine lining and makes it very impossible, almost impossible for any implantation to occur. Now, this causes chronic pelvic pain in about 18% of people with it. Now, of course, let me see what else I need to let you know about PID. Sorry, this is going to take a little while, but we'll be done in a minute. Okay, so with PID, like we treat gonorrhea and chlamydia, just ceftriaxone, 250 milligrams intramuscular injection just one time, and probably azithromycin or doxycycline, as the case may be. All right, so trick. It's called trick. Trichomoniasis vaginalis. So with trick, we have the fishy odor. Okay, it's fishy, it's foul smelling, it's foul, it's fishy. Okay, now you might not be able to see what the cervix looks like, but usually with trick, sometimes the cervix, or well, not sometimes, one way to actually diagnose trick is by looking at the cervix. It looks like a strawberry. Okay, it has a little dots all over, little red dots. And I told you earlier that anything that alters the integrity of your skin, of the cervix, of the vagina, of the penis, can actually increase your risk for STI. So trick is the most common treatable STD. Okay, it's prevalent in 7.9 to 13% of the general female population. The prevalence increases with age. The highest rates are in African Americans, Black people. The highest rates are also in the Southeast. Now, several studies support the epidemiological association between trick and HIV, and decreased HIV shedding with treatments of trick. Okay, so I don't know if you can see this picture again, but of course, the cervix looks like a strawberry, and there is discharge. It's fishy, it's smelly, it's foul smelly. All right. So in women, we diagnose usually with a wet prep, like a pap smear. Okay, we get cultures, and we'll do cultures in men also, and we do a whole bunch of other diagnostic testing that might not be necessary for you to know. So with flagyl. Okay, I remember when I was taking some of my exams, and it was so much to study at a time, and the way I said tricks are flying. So you treat trick with flagyl. Okay, so metronidazole, 2 grams, one time, or any other kind of the zoles. Okay. All right, so we're almost rounding up. The next I'm going to be talking about is bacterial vaginosis. Bacterial vaginosis is called BV. Now, this is characterized by a loss of lactobacillus producing organisms. It's the most common form of vaginitis. Okay, the prevalence is there, especially in college students, university students, in young adults, and sometimes even in older adults. A complication is premature rupture of membranes during pregnancy, premature delivery, low birth weight, acquisition of HIV, development of pelvic inflammatory disease, and post-op infections after gynecological procedures. Now, in 50% of women, BV is usually asymptomatic. The signs and symptoms are fishy smell from the vagina, and of course, we do the gram stain and the rapid test to diagnose. Now, most times when people come with BV, if they don't have symptoms, or you probably just you probably wouldn't even be able to determine what's going on. But of course, when you have all these symptoms, when you run the test, you want to just give them the flagyl. Okay, so the CDC, and that's where I'm getting all this from. Initially, I started with the WHO, and now I'm making reference to the CDC. Now, the CDC recommends the flagyl 500 milligrams twice a day for 7 days for patients with BV. Alternatively, they could get clindamycin 300 milligrams twice a day for 7 days. So I'm not trying to prescribe medications, please. You need to go see a doctor. If you're having any symptoms, I am not prescribing you no medicine. You need to run tests. You need to actually find out what's going on. You don't want to treat one thing and then your body becomes resistant because you have exposed it to so much antibiotics. Okay, so I'm going to talk now about herpes simplex human papillovirus, the HPV. This is among sexually active women, and of course in men also. So in this part of the world, what we do is give vaccines to kids from 9 to about 21 or 26 years old. All right, so with the HPV, the transmission is usually skin to skin, not necessarily sexual. Okay, so they come with genital warts, and I'm sure if you, I mean, I don't know how many of you haven't seen genital warts, but genital warts, sometimes they look like skin tags, a cluster of skin tags in any part of the genital. Usually, this increases the woman's risk for cervical cancer and other kinds of cancers. A diagnosis is simple. We'll do a cytology. So, of course, if you've never had a pap smear, I need you to go get a pap smear, usually every 5 years from when you turn 30. Okay, so about 400 to 500,000 cases, I already said this in the beginning, of cervical cancer from HPV. Now, they also can cause the anal squamous cell carcinomas, so anal cancers, okay? Now, again, I'm not sure if you can see this, but you see what the warts here look like? You see, it's like a cluster. It just looks like a cluster of skin tags, right? Yeah, this could be in the anus. It could be in the anus, and of course, if you're not very conversant, you might mistake it for hemorrhoids, but they're not hemorrhoids. Okay, and now these are genital warts in the vagina. You see how it protrudes over there. Sometimes it doesn't really look this much. Sometimes it's just maybe a couple, maybe one or two. But you just have to, take note of that. Okay, so I have another little picture. Probably not the best, but right here. You see the warts over here? You see the warts around the penis? All right, that's exactly what it looks like. Okay. All right, so sometimes you could also find the warts around the tongue. Yeah, it's gross, but of course, they're there. All right. So, like I said, we give vaccines to young females and males from 9 to about 21 or 26 years old to prevent HPV and some other, diseases that could actually come from those. All right. So, it's been a long one. But of course, the main reason for this presentation is to emphasize on the importance of practicing safe sex. If you've got to do it, you need to be very safe about it. Do not go about trusting everybody. I had a guy who came into the clinic and he was married, and well, for whatever reason, probably under the influence of alcohol, decided to do a one-time thing with a stranger without protecting himself. And of course, after a few days, he had gonorrhea. Okay, so I am trying to advocate today that for everyone to actually be conscious of this. Now, you can go get tested with your partner. You can decide to go get a screening. That wouldn't be inappropriate. It doesn't matter if you're married or not. So because the earlier you identify any of these infections, the better the chances of treating them. Okay, so practice safe sex. Try as much as possible to reduce the number of sexual partners you have as much as possible. I mean, abstain if you can, because that's the only way to avoid them. Now, but if you can't, always ensure that you protect yourself as much as you can, because the rate of infertility, erectile dysfunction, decrease in sperm production, and all the other stuff that come around with this. And of course, think about it with HIV. Of course, we could manage it, but of course, after a while, it grows into full-blown AIDS, and then But life is never guaranteed anyway. But if you can, as much as possible, try to protect yourself from sexually transmitted infections, because what you do not know might be really hurting you. All right. Thank you so much. I am so sorry. This is about the first time I'm having a video like this. I just got up from work this morning, and that kind of explains why I'm a little, sluggy with things. I'm all over the place. But thank you so much for watching. Thank you so much for listening. This is what I love to do all the time, and I love to share knowledge. If you have any questions, if you have anything you want me to talk about, please feel free to send me a message and I will definitely discuss that. Thank you all for staying by. Thank you for sticking through. I hope you have learned one or two things. And of course, my name is Edith. I will see you some other time. Bye bye.